Happy day, everyone. Today's topic is medical nutrition therapy in anemia. What is anemia? Anemia is a condition in which there is reduced number of red blood cells or decrease in the size of red blood cells or the amount of hemoglobin. This in turn results in diminished oxygen supply to tissues and organs. How can anemia be diagnosed? One of the simplest and cost-effective way is by determining hemoglobin levels in the blood. So levels below 13 in men and below 11 in women indicates anemia. Why does anemia continue to be a serious cause of concern? That is because it not only adversely affects the physical development, but also reproductive and cognitive development. Some of the adverse effects of anemia are decreased work output and capacity, irregular menstruation, low birth weight babies and preterm delivery, diminished concentration, and poor learning ability. Signs and symptoms to look for in anemia are general fatigueness, giddiness, diminished vision, severe loss of appetite, frequent headache, spooning of nails, and breathlessness. Why does anemia pose such a serious global health problem? Recent World Health Organization survey suggests that prevalence of anemia among children under the age of 5 to be 41.7%, which is a staggering number and cause of concern. And in developed countries like India, it is almost 57.3%, which is more than half of the population, which is very alarming. And another most affected group is women of reproductive age. If you look at the world prevalence, it is 32.8%, and in India, it is 51.5%, which is still more than half of the world population. More than half of the population, which calls for immediate intervention. What is all the more worrying is the recent National Family Health Survey conducted between 2019 to 21 suggests prevalence of anemia to be increased by 8.5%, which is much higher when compared to the NFHS conducted in the year 2015 to 16. All this in spite of substantial increase in iron and folic acid supplementation as tablets in pregnant women for the first 180 days and more. So this clearly suggests that supplementation through drugs is ineffective and does not control and fails to control anemia. Let's look at the national prevalence summary here. India holds the highest record for anemia in the world, inclusive of Africa. It is even higher among women. Hence, the probability of maternal and child mortality is high in developing countries. 40% of maternal death is attributed to anemia, according to World Health Organization, and India contributes 80% of the maternal deaths due to anemia in South Asia. In Kerala, anemia level is the lowest in the country at around 30%. According to National Family Health Survey 5 done in the year 2019 to 21, 57.4% of children under 5 are anemic in Tamil Nadu. So that calls for immediate intervention through dietary approaches. Some of the common causes of anemia are inadequate iron intake due to poor diet, then increased iron excretion due to excessive menstruation and hemorrhage, increased iron need during infancy, adolescence, pregnancy, and lactation, inadequate iron absorption resulting from diarrhea, achlorhydria, and gastrointestinal diseases. Also, deficiencies of micronutrients such as iron, folic acid, and vitamin A. Malaria and sickle cell disease, also parasitic infestations such as hookworm infestation, And other chronic diseases such as cancer, HIV, AIDS, and arthritis are some of the common causes of anemia, along with both under and overnutrition. Today, the focus is on nutritional anemia, that is, anemia caused due to the deficiency of one or more nutrients such as iron, vitamin B12, folic acid, vitamin A, vitamin C, and protein. Of all the deficiencies, iron deficiency anemia is the most common form of anemia in the world. So let's look at some of the causes of nutritional anemia in children. Firstly, it is low iron stores at birth. Second, non-exclusive breastfeeding in the first 6 months. Too early or too late introduction of inappropriate complementary foods, insufficient quantity of iron and iron enhancers in diet, and low bioavailability of dietary iron. Increased iron requirements related to rapid growth and development during infancy and childhood, iron loss due to parasite load, as in malaria and intestinal worms, poor environmental sanitation, unsafe drinking water, and inadequate personal hygiene adds to the woes. Some of the causes of nutritional anemia in women are iron loss during excessive menstruation, iron loss from postpartum hemorrhage, teenage pregnancy, and repeated pregnancies with less than 2 years interval. How do we boost iron levels in the body? By consuming iron-rich food on a daily basis. Liver is the best source of iron, and also heme iron from fish, meat, and poultry is better absorbed than non-heme iron from plant sources. Millets like bajra, that is kambu in Tamil, ragi, kudiravali, thinai, and varagu are also very good sources of iron. Green leafy vegetables, especially drumstick leaves, is very effective in improving anemia. Fruits like gooseberries, guava, lime, and oranges are rich sources of vitamin C, which increase the absorption of iron. Garden cress seeds, also called as ali vidai, and gingerly seeds can be used in making sweet treats for children. White sugar, which is devoid of micronutrients, can be substituted with jaggery and palm sugar, which is rich in vitamins and minerals. Dates and black raisins can be considered as a snack option to school. And also aval, called as flattened rice or poha, is a very good source of iron. Now, not all iron are equal. Some are more equal than the other. For instance, the heme iron from meat, fish, and poultry is absorbed 2 to 4 times more than the non-heme iron from plant sources. So, does that suggest that vegetarians are at higher risk? No, not at all. There are other enhancing factors that increase the absorption of iron. One such factor is ascorbic acid. Even a small piece of amla or guava taken along with a meal increases the absorption of iron from that meal by 85%. Similarly, tartaric acid found in tamarind, which is otherwise called as puli, when taken in small quantities, increases iron absorption. So, please do remember to add puli while making green leafy vegetables and fish korambu. But too much of puli is also not good for health. That would lead to anemia. It's not only acids from food, but it is also acid secretions in the stomach that increase the iron absorption. So that is the reason why we do not suggest taking water just before a meal or during a meal, because this dilutes the hydrochloric acid in the stomach, which in turn decreases the absorption of iron. Although human milk is low in iron, but the presence of lactoferrin and lactoglobulin in it increases the iron absorption manifolds. And whenever there is an increase in body need, such as hemorrhage, blood donation, excessive menstruation, and periods of rapid growth, such as infancy, adolescence, pregnancy, and lactation, there is an increase in the absorption of iron. Now, let us look at some of the factors that decrease the absorption of iron. As we age, the gastric secretion in the stomach naturally decreases. This in turn decreases the absorption of iron. Not only that, excessive intake of antacids also decreases the acidic level in the stomach, which in turn inhibits the absorption of iron. So please do not take antacids for a long period of time. Also, too much of fiber interferes with absorption of iron. That is because fiber-rich foods are also rich in phytates and oxalates. Phytates and oxalates are anti-nutrients, that is, they bind with iron and make it unavailable for absorption in the body. Next is tannins. Tannins present in tea and coffee interfere with the absorption of iron. They reduce the iron absorption by as much as 75%. Then EDTA, that is ethylene diamine tetraacetic acid, a common food preservative used in salad dressings, mayonnaise, interferes with iron absorption. It reduces the iron absorption by as much as 50%. Then excessive intake of milk, cheese and eggs also leads to decreased absorption of iron. The reason being, the calcium present in milk competes with iron for absorption. So it is best to take calcium-rich sources and iron-rich sources separately. And that is why pediatricians do not suggest more than 2 to 3 glasses of milk for growing children. Too much or excess intake of milk could result in anemia and also infection. Now, I have put together some dietary recommendations to overcome anemia. First being dietary diversification. What does that mean? Dietary diversification is including a variety of food from all the 5 food groups. The food groups being cereals, grains and millets. The second one, pulses and legumes. Third, fruits and vegetables. Fourth, milk, milk products, meat and meat products. And last, fats and sugars. Second being dietary modification. What does that mean? Simple processing techniques such as soaking, fermentation and germination increases the bioavailability of iron from food. One such example is ragi. Ragi is not only rich in iron and selenium, but it is also rich in anti-nutrients such as phytates and oxalates, which bind to iron and make it unavailable to the body. These anti-nutrients can be easily removed by a simple step called as fermentation. And one such example is ragi kuru, which is served in the month of Adi in Tamil Nadu. So that is a good example of a fermented ragi product where the anti-nutrients are removed by fermentation. So this in turn will result in increased bioavailability of iron. And also it helps to take at least one source of vitamin C with every meal. Remember, an amla a day keeps the doctor away. Avoid drinking large amounts of tea and coffee as it has tannins and it will interfere with iron absorption, and also water with meals because that decreases the acidity, which in turn decreases the absorption of iron. Avoid high quantities of EDTA preservative by checking labels. Deworming, that is very important not only in children but also adults alike. The most effective way of deworming is preparing paste from tender neem leaves at regular intervals. That is the most effective way to deworm. And what is that we can learn from our neighboring state, Kerala, which has got the lowest prevalence of anemia in the world. So if you see, every household in Kerala has their own kitchen garden. They grow their own green leafy vegetables. This, along with regular intake of fish, is one of the reasons why the prevalence is very low in Kerala. Then I would like to share an interesting fact on Ekadeshi fasting, which is considered as the king of all fasting. So after more than 36 hours of fasting, we break the fast and only certain foods are allowed, at the time of fast. So there's a lot of science behind the choice of foods that are taken to break the fast. One such food is agati kire, which is a very rich source of iron. So it is not only rich in iron, but it also douses the fire, in the stomach, because after a long fast, there is a lot of acid secretion. So by now we know that acidity increases the absorption of iron. This, along with Nellikai rasam that is used to break the fast, we all know that gooseberry is a very rich source of iron, which enhances the absorption of iron from agati kire. So it is not for no reason that they said our Indus Valley civilization is one of the most advanced civilizations in the world. Sadly, we have lost all our traditional knowledge to Western practices. And also, I suggest use of iron kadai instead of aluminium and non-stick pans. Lastly, use of iron fortified salt. I would like to conclude by saying, look to farm and not pharmacy for nutritional related problems. Micronutrient deficiencies should be addressed through food and not to drugs. So, food related remedies are the best. Thank you for your patient listening.